Hi, my name is Layla. I just finished my NYC program at Part 2. I never liked going to the hospital because of lack of drugs, personnel, and generally poor service. I know a lot of people out there feel the same way because the Nigerian health system is not functioning properly. But Part 2 is supporting the Nigerian health system at federal and state levels to improve the whole situation with adequate information to improve planning, provision of drugs to hospitals, and training of health workers at grassroots level because our programs are pro-poor and pro-vulnerable. By these efforts, some of our hospitals and health centers are becoming what they really should be.
My name is Abodike Oyini and I serve with Part 2, Abuja. I worked in the Public Health Communications Department. And during my stay in Part 2, I came to realize that the federal government and donor agencies are really doing a lot towards improving the Nigerian health sector. My background is in mass communication and I never knew I would have anything to do with the health sector. Coming to Part 2 has really broadened my horizon when it comes to issues concerning health. Take for instance, the Ask Nigeria brings health service providers and the people at the grassroots together to discuss health problems and proper solutions to these problems. I've learned that communication in health is not just about spreading information. It's about research, it's about behavioral change, and creating situations where people can come together and address basic health issues, thereby ensuring that policymakers are accountable and responsive to the needs of the people.
Just like I was saying, I didn't really have so much of information about health sector, how the health sector works. Really, I knew there was health sector, but how the health sector was. But when I came into Part 2, I realized that there are a lot of things happening in a lot of steps, as in a lot of, when it comes to health facilities, when it comes to drugs issue, the DRF, and when it comes to training of the health facility workers, a lot of other things are really, so that was like, working in Part 2 was an eye opener for me per se. It was really like, wow, so these are things that happen, as this is what is happening in Jigawa, this is what is happening in Kano. So much of lack of information, lack of illiteracy. There was this illiteracy problem and a lot of that. But I realized that at the end of the day, one thing that Part 2 has been able to do, because one of the major purpose or aim of Part 2 is strengthening Nigerian health systems, and I realized that in Jigawa State, in Kano State, they have been able to do that. Now, for the department that I am right now, Voice and Accountability, they've been able to, to be able to reach out, to the grassroots level now in terms of, creating FHCs, the FHCs, bringing getting the CSOs, to work with the FHCs, to get down to the grass, to get down to the people, down there, ask questions about, what is going on, okay, what, go down and, look at the facilities that they have, realize when they got there, like when I was talking to one of B&A people, he was like, when they got there, they realized that they were, lack of drugs, lack of, you realize that even health workers, their attitude towards work is so bad, and then, they realized that by the intervention of Part 2, a lot of things have changed. We realize in some local governments, attitude of health workers have changed. They come early, in fact, there was even a particular local government that they've come together, they restructured the face of the health facility. They did a lot of things, talking about drugs. They were able to get drugs there, so a lot of things like that.
Okay. I never knew the global positioning system would be used in developing the Nigerian health sector. But having worked at Part 2, I realized that applying technology can help to map out health centers, especially in the grassroots, plan how to deliver drugs, personnel, medical supplies, and other forms of support to the health centers. I, as a Nigerian youth, have learned that we can apply technology to develop our health system, and I'm happy to be part of it.